Do you have type 2 diabetes? If so, you're not alone. The Centers for Disease Control estimates that about 15% of adults in the United States, or 37 million people, have type 2 diabetes. Now, did you know that the older you are, the more likely you are to have type 2 diabetes? About 19% of people 45 to 64 years of age, and almost 30% of people 65 years of age or older, live with the disease. What about race or ethnicity? Among the largest population groups in the United States, type 2 diabetes is most common in Black individuals, followed by Asian, Hispanic, and white individuals. If you have type 2 diabetes, you probably know that your body has trouble controlling the amount of glucose, or sugar, in your blood. You also probably know that controlling your blood glucose is very important. This can be done through medication, diet, exercise, or best, a combination of these. By controlling your blood glucose, you can reduce the chances of common complications of diabetes, such as diabetic eye disease and kidney disease. However, by the time many patients are diagnosed with type 2 diabetes, they already have a higher risk of cardiovascular disease, which can lead to heart attack, heart failure, which happens when the heart doesn't pump blood as well as it should, and stroke. Did you know that cardiovascular disease, which includes a wide range of disorders of the heart and blood vessels, leads to nearly 2 million hospitalizations each year and is the #1 cause of death among people with diabetes? Why is cardiovascular disease so common in patients with type 2 diabetes? Partially because higher blood glucose by itself can damage nerves that control both the heart and blood vessels, as well as the blood vessels themselves, almost doubling the risk of heart disease or stroke. For example, just a 1% increase in hemoglobin A1C in people with diabetes increases by 18% the risk of heart attack, stroke, or peripheral artery disease, which is the narrowing or blockage of vessels that carry blood to the legs. But even beyond blood glucose levels, many patients with type 2 diabetes also have other risk factors for cardiovascular disease, including high blood pressure, high cholesterol, and obesity. By themselves, these risk factors are dangerous enough, but the combination of them with diabetes increases the risk of cardiovascular disease nearly 5 times, and if you're a smoker, the risk increases even more. So if you have type 2 diabetes, you and your healthcare provider need to work together on a comprehensive plan to manage all aspects of your disease. It's not just about controlling blood glucose or blood pressure or cholesterol or stopping smoking. It's about how to manage all of these together. If this list sounds scary, just remember that you aren't doing this alone. There are many steps that you and your healthcare provider can take as a team. Let's break this down according to recommendations for cardiovascular risk reduction from the American Heart Association. These include lifestyle management, blood glucose management, blood pressure management, and cholesterol management. Now, it's important to know that all of these steps work together and have benefits on more than one aspect of type 2 diabetes and cardiovascular risk. Lifestyle management is critical and includes diabetes self-management education, exercise, dietary changes, weight loss, and steps to stop smoking. The American Diabetes Association recommends at least 2.5 hours of aerobic activity each week, but any physical activity helps. Increased physical activity improves blood glucose control and cholesterol and reduces the risk of cardiovascular disease and death in patients with type 2 diabetes. Changes in your diet can have benefits across many aspects of heart health, including improved control of blood glucose, reductions in cholesterol and blood pressure, and weight loss. Even a small weight loss of 3 to 5% can improve blood glucose control and start to reduce cardiovascular risk, with greater weight loss having greater benefits. And then smoking. Quitting smoking can lower your risk for heart attack and stroke, improve your blood circulation, and maybe even improve your blood glucose and A1C, blood pressure, and cholesterol. Unfortunately, for most people, lifestyle management alone is not enough to control type 2 diabetes and all the other factors contributing to cardiovascular risk, and that's okay. Medications for blood pressure, cholesterol, and blood glucose control are commonly prescribed and help many people manage their disease. Let's talk about blood pressure and cholesterol first. There are several types of medications that your healthcare provider may recommend to treat high blood pressure and reduce your cardiovascular risk. What about cholesterol? When lifestyle changes alone are not enough, a type of medication called statins is most often prescribed. Statins have been shown over and over to reduce cardiovascular risk. Now let's talk seriously about medications for type 2 diabetes. Although there are multiple treatment options, two types of medications, SGLT2 inhibitors and GLP-1 receptor agonists, have been found to protect patients against cardiovascular events beyond their impact on blood glucose alone. In fact, it's strongly recommended that these medications be used by patients with type 2 diabetes and cardiovascular disease, or at high risk for cardiovascular disease. Of course, these medications have been tested for safety and effectiveness in a large number of clinical trials. Even more than that, though, they have been tested in clinical trials specially designed to look at cardiovascular risk. Across these trials, GLP-1s reduce the risk of heart attack, stroke, and death due to cardiovascular causes after many years of use. And based on these studies, 3 of the GLP-1 receptor agonists are even approved by the Food and Drug Administration, or FDA, to help prevent heart attack or stroke. Some of the SGLT2s have also been approved by the FDA for reducing cardiovascular risk, but may be more effective in patients 65 years of age or older, and in those already with cardiovascular disease. They may also be most effective for addressing heart failure. So because the SGLT2s and GLP-1s may address different aspects of cardiovascular risk in different patient populations, the medication recommended by your healthcare provider should be personalized to your needs. And when it comes to medications for treating type 2 diabetes and reducing cardiovascular risk, the importance of weight loss cannot be overlooked. Although there are several medications approved for weight loss, 2 of these are GLP-1s. So some GLP-1s can help with multiple aspects of cardiovascular risk, from control of blood glucose to protective effects on the heart and blood vessels to weight loss. On the other hand, some older medications for type 2 diabetes can lead to weight gain. So be sure to ask your healthcare provider about your current treatment and find out if it might be time for a change. So, do you know your cardiovascular risk profile? Do you know your blood glucose, blood pressure, and cholesterol goals? Would weight loss help? Be sure to talk to your healthcare provider about these topics at your next appointment, so as a team making decisions together, you can find out if your current treatment is best for meeting your individual needs. Don't wait to start this discussion because it's so important to address your cardiovascular risk as early as possible. You may feel uncomfortable starting these conversations with your provider, so prepare for your appointment. Take advantage of the additional resources provided to educate yourself further on type 2 diabetes and cardiovascular risk. Make a plan for what you want to discuss, and even make a list if it helps. In the end, by talking to your healthcare provider, the 2 of you can develop a strategy to best control your type 2 diabetes and reduce your cardiovascular risk. It's a conversation that could just save your life.